Welcome to The Digital Footprint, a podcast for leaders in healthcare, public health, and education who are looking to leverage technology to solve problems and make a big impact. In each episode, we interview innovators and entrepreneurs who are solving the most challenging problems facing these industries. Join us as we dig into the colossal tasks involved in bringing a new digital product to life. Welcome to The Digital Footprint.
Hello, and welcome to The Digital Footprint. I'm Richard Sims.
And I'm Carlos Gonzales.
This podcast is brought to you by Tyrannosaurus Tech, an award-winning technology partner dedicated to designing and developing high-impact software products. We're very excited. Today is the day. This is episode 1. We've been planning this podcast for quite a while, so we're thrilled to be launching here at the outset of 2021. And for our first guest, we've got Hal King, founder of Public Health Innovations. Thanks for joining us, Hal. We have known Hal for a long time, one of our best and earliest clients. And really, Hal, we have a lot to thank you for, because a lot of our efforts to increasingly grow into public health and healthcare really stems from our early work with you in the food safety space, and finding a lot of passion in working on products that we felt like could really help people. So thank you for that. So to get things started and give our audience a little background on you, in 60 seconds or so, can you tell us a little bit about just kind of your background, your experience in public health, and how you came to be focused on food safety?
Sure, thank you. And thank you for the opportunity to do this first one with you, Richard and Carlos. I'm a big fan of Tyrannosaurus Tech. I've learned so much from you guys, in the journey that we've taken on developing mobile apps. My journey actually began as a PhD in infectious disease. So what does that got to do with, mobile technologies and things like that? But, in actual use, when I did my PhD, I had to go to libraries and actually check out journals and books and have them load up into an office and then come back there and read them all, make copies, and try to write from them. Today I can go on the internet and find that same paper in a PDF, read it, and instantly use it in a book I'm writing, right, or something like that. So technology's got a huge impact on knowledge, transfer of knowledge, and actually being able to create new knowledge by kind of looking at what's been done, right? And so my background history is that I got my PhD in infectious disease at University of Georgia. I went to CDC in Atlanta. That's where people that like me go to work in infectious disease prevention, and did outbreak investigations all over the world with the CDC and WHO, and really had a lot of respect for that organization. I only left because I wanted to do more than what the government had money to do. And so I went to Emory University where I could write grants and develop research projects to focus on emerging diseases, mainly in West Africa and the US, those kind of things like COVID that come over from somewhere else and then come over here and hurt a lot of people. So did all that. But about 7 years into that gig, we had 9/11 hit. And because I was a US Public Health Service officer, that's under the Surgeon General and Department of Defense, they pulled me out into the U.S. Army, and I wasn't a very good shooter, but I could think about biological threats and things like that. They never gave me a gun; they were worried about that. But did that, and so really couldn't do Emory, write grants, and do all that. So I decided to ask a friend of mine if I could go work for him. He actually owned Chick-fil-A, Mr. Truett Cathy, and try to just kind of take everything I'd learned in public health to apply it to food safety. Because I'd investigated a lot of foodborne disease outbreaks when I was at CDC, and we worked on these things. But got a great opportunity for work about 11 years there to build their program. And I learned so much, I decided to leave in 2014 and then take it out, that knowledge, to go transfer it to the industry. So working with companies like Starbucks, Chipotle, we just kind of want to go out and help them do the same thing Chick-fil-A was doing, at least from my perspective, what I learned there. So that's my journey. And I know we'll talk a little bit about how it connected with you guys.
Yeah, that's awesome. And obviously it's a interesting road you've been on, and I'm sure you've been exposed to some really, a big range of risks and threats and exciting, progressions in that space. So very cool. So for listeners who aren't familiar with public health innovations specifically, tell us a little bit about, what you all do today, day to day, and, how you're helping people.
So I never went to business school, but when I left, I had a lot of experience working with business people, especially at Chick-fil-A, right? That was a pretty big business. And when I was at CDC, I was always frustrated with, the words, the government doesn't do this. We don't create vaccines. We don't manufacture diagnostic kits. We don't make, right? The government doesn't make any of those things. They have to partner with the industry to make those things. Thank God we do, right? Now that we have these vaccines from these businesses like Pfizer and Modelo and all those that the government worked with them, and even to the point of getting them safe through the FDA reviews and stuff. But so it's a partnership, right, between the government, industry, sometimes even the military. And so I wanted Public Health Innovations to be a for-profit business that did that, help liaison between the government and the businesses and the industry to innovate new products to save lives, prevent people from getting sick, from infectious diseases, from foodborne illnesses, all that. I actually then created, and how we got associated was into the fact that there were a lot of things that people still needed that were kind of more of the basic understanding of application, right? So we might know how to invent or create something new, but the application to ensure the controls were there. It's almost like we know a lot about people get hurt when their children are in a cul-de-sac and they run out and play in the cul-de-sac. How do we, cars are still going to come in cul-de-sacs and turn around and go back out, but how do we protect our children? So we don't start thinking about the reason why that happens. We start thinking about how do I make sure that my child doesn't get hit by a car in the cul-de-sac. And so that level of thinking drove us to create Active Food Safety, which was very targeted to just the food safety industry or the food industry, to try to build controls and knowledge and transfer that knowledge to the industry to help them prevent foodborne disease outbreaks.
Very cool. And I know for Active Food Safety, that's kind of, where your products live under that brand and that LLC. And so I understand that was a big part of kind of launching that separate entity. And I know also you raised capital for some of those ventures, which of course for I think a lot of our listeners that are, thinking about launching some type of digital product, funding, of course, whatever form that comes in is a big question mark or part of that equation. What was that experience like for you for Active Food Safety specifically?
Well, I think if thinking in terms of if you're starting a new company or you're trying to launch digital projects, within your company, I think we all know people, and it's really about relationships that want to do the same thing. And, I had worked with this fella at the National Restaurant Association when I was in Chick-fil-A. He was in Washington, Chicago, and he had done some of this stuff in that organization. And so I just went to him and said, hey, I want to do this. And he wanted to do it. So that's sometimes I know it sounds easy, but sometimes it's like go to your relationships and don't go with the fact that I just need money. You're going with, I need a partner to go do this. And oh yeah, we need money. And, sometimes those partners are the ones that actually have the resources to invest, the angel investments and even that sort of thing, that then all have the connections to help you grow your business. In the future, you might actually, they know folks that can help you finance additional growth or new things. So that's kind of what we did. We just said we're like-minded in the things that we want to do to prevent foodborne illnesses, and they have access to capital. And then we trust each other because we've done a lot of these things before in relationships and business. Let's go do this. And then that's kind of, we landed on you. He's like, well, we don't know how to do this. We had to find somebody that knows how to do this. So Tyrannosaurus Tech was there. Thank goodness we had to go back in time and find you, were the dinosaurs. You were actually here.
Well,
I had to put that little comment in there. I love the dinosaur.
Well, we're obviously so glad we synced up, and it was kind of serendipitous. I think you originally were talking to another team here in Atlanta that for whatever reason, they didn't have the bandwidth or something to that effect. And I'm so glad that all fell into place. So when we first started working together, I think that was in 2017, and you approached us with this product, Emerge Protect, in mind. So one question I have for you is, you having that deep industry expertise, really understanding the problems that need to be addressed, but not coming from a software development background. What led you to want to launch a digital product, and what kind of, got you to that tipping point? Because it's a risky endeavor, naturally, anytime you're pursuing a new product. Like, what kind of led to being willing to kind of jump on that?
Yeah, I think it came from a frustration, really. It really felt that frustration when I was at Chick-fil-A because, when you have over 1,000 restaurants and lots of people working and then have an emergency, they pick up the phone and call corporate, and then corporate pushes them over to you. And, you can't take 1,000 calls a day. You'd never get to work on anything else, but they're important calls. You want to help them. Like most of the emergencies that were going on at the time were things like the water main shut off and we have no water. Can we keep the restaurant open safely? Or someone just threw up in the dining room. What do I do? Should I shut the restaurant down? Or all these little emergencies. Some customer called in and said they got sick from our food. What do I do? How do I respond to the customer? Did I? How do I know if it did or not? Right. So that you can imagine all the details in that response. And if you're getting multiple calls, you've got to hire a whole team of people to be able to be trained and educated to give the response. Yes, you can operate the restaurant with a water break. It's called boil water. You got the procedures. Here are the procedures. Call the health department. Let them know you're going to stay open. Buy the Coke cans and all this. Right. There are ways to save your business and save a lot of money and not shut it down. Right. And so, but that takes time to show people. And then if you try to put it in a paper copy in a manual and just said to reply to the call, go look at your manual. Well, what if the manual wasn't updated last year and the regulations or requirements to do that operation in that area is changed? Well, then there's no way to know that then they do something and it might actually cause high risk, or they might have to get shut down by the health department because they're not following the requirements. So to me, that drove me to think that mobile technology, especially when we all use the smartphones and all this stuff for access to knowledge and information, and to look up things, and we Google stuff to find out the answer. But really, you could Google things and also get the wrong answer, right? Because you really need to have a source of truth. So you need someone that actually has made that. Like we use WebMD because we trust WebMD. It's got a core of scientists and physicians. It was started at Emory University. Go Emory. And so, this is something where it's a source of truth. So we'd go there and search rather than just Google this topic. And so that was my need, is I felt like if we could use this through mobile applications like Emerge and Protect, we could constantly put the updated material on there. You guys helped us learn how to do that, so that when it's updated, it goes through native code and it goes instantly. When we change something on our CMS side of the language or whatever, it gets updated on everybody's phone without them even having to download and update. It goes right through the Google Store and Apple Store instantly. It's brilliant, actually, because it's real-time updated information to take application to their user. And that was the vision for Emerge and Protect. And really, when we met you guys, no one really actually had a personal kind of relationship and describing what they do and what they could do and what they couldn't do. You guys were really good at actually showing us what we could do and couldn't do and what you'd recommend we do, because we'd never built something like this, so that we could really focus on the content and the functions and all that, and use the UX design to put it in the hands of a manager, so the manager could just get to the information very quickly and use it. We learned so much in developing the apps with you, but it was key to have the right people, because again, if there's just a tech person that goes, you can't do this, you can't do this, you guys said, here's how we would recommend you do it. And that gave us peace of mind at a very low cost point to actually develop it. And now that app is actually in the marketplace, sponsored by Gojo and Perel, a huge company, right? And we all know Perel, as a free app for the industry, because it gives them access to that knowledge and they don't have to go pay for it even off the App Store. So what we did was we built a very useful tool that got the attention of larger brands that actually could provide it to the industry they're in. All for that full cycle, right? Just from an idea. Hey, let's take this issue that's difficult to do, just get some technology, build a mobile app, and put it out there. I still to today, I'm still overwhelmed that we were able to do that. But it was key to have that all in place to be able to kind of achieve that result.
That's great, Hal. I think understanding the business problem and the challenges in the industry is one side of the equation, but yeah, building the product itself, defining it, and diving into development is a whole different beast. With Emerge Protect, what did you find to be the hardest part about building and launching that product?
I think when we started to build it and show it to people, I got caught off guard because they would say, where's this data at? Or does it collect our data? Does it, they were asking all kind of general questions about the technology. And the same thing happened with Active Manager, another app we made that actually does store data on the phone and push data in the cloud. And they would say, well, how does that work? And where does it go? And where's the data? Can I take the data off? And, just kind of a lot of stuff that I wasn't a technology person. And my son Joshua King, who's actually helped with the UX design, he designed all the apps as it related to their functional stuff. And that was just really, I was like, okay, so we remember we had to come back to you and go, can y'all diagram this with pictures, so we can understand how this text kind of works through the system, because people are asking us all this kind of question. Some of it's probably because we weren't a technology company, and we needed to partner with a technology company that could do that for us. So and many times we would have just preferred to give it to you guys, but it's because you have other apps and other clients and things. We didn't want to bother you and have to do that for us all the time. So that was really kind of what, to me, was the hardest part, was just trying to understand. And again, part of that also translated to when we wanted to do something like bugs. Generally, you guys taught us, whenever you write code, there's always going to be not bugs from the writing the code, but changes to other people's software that might be using that code or reflecting that code, or that code's doing something like saving data somewhere to a cloud, like the Amazon cloud or something like that. And so trying to really understand that and be educated by you guys was really helpful, because I was really struggling with, should we do this, right? If we need to do this, should we do it now? What's it cost? If it's going to cost this, is that going to help us grow the product, make the product better, or should we wait? And if we wait, what's that going to mean? I think the number one thing that comes to this day is, Apple's changed their software, to the App Store, and we need to upgrade our thing through our system, and it's going to cost us to do something. And the first question I always ask is, do we have to do that? Well, yeah, it'll boot it off the App Store, right? Well, yeah, we have to fix this, put the code or whatever. So I think those are the things I wasn't prepared for. But if you actually do start and build an app, I'd highly recommend to users that you also get funding to support the maintenance and management of that as you grow. And that's something we're in the middle of right now, as we're going to that next step, is getting financial and capital growth to move it into the technology world to sell it. It's just been, COVID kind of delayed a lot of things this last year that we had planned to do, but that's the part that, again, the good news is we learned all that from you, and we felt very comfortable with now the decisions we needed to make then and now to actually get ready to go and launch these things to the market.
Great. As we know from what you've mentioned, you went from doing consulting services primarily to actually defining these products and, launching them. For listeners that might be in a similar position, where they are delivering consulting services and have potentially identified a digital product that would be really beneficial to their clients. What would you say was the biggest difference between going from consulting to running more of a tech company?
Well, like I said, we were not tech, knowledge and savvy, except Joshua King was. He had that because he had gone to school for that and understood the language. But again, there was always still that that healthy challenge between even he and I, and what could be done and shouldn't be done, because he's looking at the technical side, I'm looking at the functional side and the end user and the purchasing of that product and things like that. I think what I would advise folks to do is, again, do make sure that you understand the kind of the A to Z of what you want to do with that, including, being prepared that when you're in letter M and N and O and P, that there's going to be predictable kind of needs to update, change, fix code, based on all the things that you're trying to do with that product. And then always being able to pivot, based on that, because technology needs to pivot. You can't be static, because if it becomes static, it's like an old game, right? No one plays it anymore. And so I think that's really what I would advise folks to do. The power of it, because I get caught up in the value and the power of it. Like, I write books, And then I expect, I tell people, if you want to talk to me, read the book first, because then we're on the same page, right? Because they've read what I feel and how I believe and what I have written. But if they don't read the book and they talk to me, I can't still say, well, you're not on the same page as me. I can't go to the next level. I have to go back up, and get them to understand kind of the summary of how I see this and how it works. And that's kind of what mobile apps do too, and technologies do. You're letting people jump in, download something without any prior prerequisites or knowledge or things like that. So you have to be sure to ensure. Now we all know functional, it's easy to touch and click and discover functions. But when you're talking about trying to deliver, and I think the purpose of this podcast is centered around public health. You're trying to actually make sure that they understand the what, but also the why. Because many times people don't take action if they're not convinced of the why. And so, mobile apps can do all these things, but the credibility of the information is going to be strong and updatable, like you guys showed us. But then the ability to make sure that the user can understand and get the details and information with that technology of why they're doing it, including the outcomes, so that you can kind of influence that. Because it's not a game, it's people's lives. And so it's, those kind of things you want to make sure it's got the high rigor of credibility and application. So that's kind of what I would have advised, at least as it relates to anyone in the business of public health, which like we are, as they look at technology and the use of technology.
Definitely. So after that Emerging Protect project, which from a technical perspective, it was more of a straightforward product, but then we later dove into a much larger scale, project, which was Active Manager. How did your experience compare from one product to the other?
Well, it was definitely a future shock. That's an old word we used from the 60s. You guys won't know what that means, but it definitely was. We didn't know what was coming, in the future. And so, again, it was a big learning curve because now we're actually interacting with stuff, in the app. That's going back and forth between the user's phone and to the internet and then to someone else's cloud storage and then someone else's SMS texting system, and all these things that we were trying to build together to function in an app that would do assessments, say, for example, in a restaurant, where I could go check things based on what the app's telling me to check and then get information and enter it into the app. That's easy to collect that information. And then if something's not right at the user interface, it's alerting me that's not right. You need to back up and correct this, right? And then storing that information, so that someone else can come back and see what happened and was it fixed, and then pushing all that information to a website that, like, say I'm an owner of 3 restaurants and I'm looking at my 3 restaurants from Active Manager data on my dashboard. Now that's all coming into my website and I'm clicking to look at information from just one restaurant or what Hal did in that restaurant. Now we're actually getting into what happened, from a data analytics standpoint to the interface of the user. So the website has to also be generally user-friendly to be able to see things quickly because they're not going to be trained on how to do the things that I know how to do. If I was sitting at a corporation and doing a data analytics, they need to be able to make it simple and easy that they can click through and find the answers that are more intuitive to their business, right? They're not in the business of public health. They're in the business of making food, selling food, growing their sales. But we still want that under foundation of the public health functions within that whole process between the manager using the app and the restaurant, right? And the folks that are actually managing what the data is showing them, or even adding employee names, right? New employees that get hired. Or were their employees trained? You can't expect them to be doing this when they find in the assessment they're not doing it, but they were never trained. How would you keep up with all that? So look at the technology, the breadth of things that need to be put in place and coded that one person could see all that on their screen or on their mobile app, right? And so to me, it was a future shot because all the things I knew I wanted to do in the past, I'd just say to a big technology company when I was at Chick-fil-A, these are the things I wanted all to do. But when we were doing it, we had to kind of go back and forth. Well, how do you want it to do this or show this? Because do you want to leave the data on there forever? Do you want to have it scrub the data if the user clicks it and can delete their data? Those are all kind of business decisions based on trying to predict what the customer, the business user, is going to actually do. And then on top of that, try to sell it, right? You want to go out there and market and sell that product for its values and benefits. And so we did have a lot to learn. And we're now on that last end of that learning curve to know what we want to do next now as we get ready to roll this out. It's available on our app stores, but we are still working on improvements of it and getting ready to roll it out as a big process in the industry for how they would use it. So even training on how to use some of this stuff could be important too. But that's definitely something, again, like I said, it's got to have the right technology partner, because I know we probably drove you guys crazy. I know I do. But at the same time, you guys we have a great relationship. We're friends, and we became friends and business partners too. So we got what we needed when it did, and it helped us make sure that we didn't spend a lot of money on things that weren't necessary at the stage we were at, with the app and stuff. So
Great. At this point, you've built a couple of products with us. It's been a fun experience. I would say that you've learned a lot through the process. As we go into the third and fourth product, what would you say worked from the process and the things that we did before, and what would you do differently going forward?
What didn't work was that our ignorance of, the details from what we were asking to do. Like I said, when we did Emergent Protect, it was just information that we're putting out there in the App Store, and it's available to the user on their phone as an app, and they get information. But when we got into the part where we made an app that actually collected information and pushed it back to a dashboard on a computer, right? And then had multiple users in multiple locations. The complexity of that, we just should have gotten, what we should have done is gotten more educated on kind of what it meant when we were saying what we wanted to do between that. We kind of just started right in, here's what we want, and focused on the app. And we didn't really focus a lot on the data, use of the data. And if we probably had backed up and started thinking about what's the user need in the data and analytics and focus there, almost building the dashboard of how they're going to use the data and then build the app. Now, certainly we did that. The app, took a longer time because we had to go back and forth, kind of make the app go back and forth, do the things that we were seeing. Even when we piloted the apps in restaurants, we're hearing that feedback. Can we get to this information quicker here? Can we do this faster? Can we do? And so I think that's just what our lessons learned was to really better kind of, again, I forget what you guys call it when you map out all those things, before you actually start coding. You guys were patient with us, and sometimes we would say we just do this, kind of stuff. But definitely, I think that's over time we've learned that it's better to go ahead and map all that out and test that and get back input of all that before you actually start doing the coding, and then you start building the app that way.
Yeah, for sure. And I think totally understand that. It's funny because we naturally have grown and evolved as a business, and as much as you've been kind in complimenting us on educating you on the process, that's been a big focus for us because that kind of disconnect can be really difficult in terms of making a product successful, but just making that relationship healthy, right? And I think as you were just referring to, what a lot of folks naturally don't understand is that process of getting all of the business requirements laid out, thinking through all of these edge cases that are, difficult to even think of unless you're being really meticulous about it, having a very thorough scope. It's definitely a, measure twice, cut once kind of mentality that I think we continue to, hopefully in a healthy way, have to educate clients, particularly when they're coming in and building a greenfield product. And Active Manager on the whole is pretty sophisticated. So there's just lots of things like that even if you try your best, there's going to be things you don't think through that you have to address in time. But of course, the more you can get ahead of that, the better. So yeah, lessons learned for us along the way too, through all of this.
I think, and I would say this, Richard, and Carlos, that again, part of that was our thinking that we wanted to kind of deliver the information and the exact process and the check that you should do and the training required. We wanted to deliver all that in Active Manager like we had done in Emergent Protect. You know, we are the experts. We have experts in our business that have done this in major companies like Darden, Waffle House, Chick-fil-A. So we know what you should be doing in the restaurant, right? So we designed the app to just do that without any negotiation with the user, right? We're like, this is what you should be doing. This is what should be checking. This is how you do it. And so one lesson learned was, a lot of the competitors we have, which are big technology companies that are out there, they have lots of money and funding. They have learned that they go to market telling the client, what do you want us to do? What do you want the app to do? They have the app foundations, and app systems, and things like that built out, but they're plug and play type. What do you want to do an assessment of, right? What do you want to check? They kind of leave it up to the business, the enterprise, the food company, to tell them what to do, and then they make the app do that because it's already been built on the kind of Lego process, right? Where you just help them. I want to do an assessment of this, cooking this, checking this. I want you to do this when it happens. So they built all that within the apps. But we didn't feel like that was necessary. If you just want to focus on one thing, stopping people from getting sick when they eat in a restaurant. So we didn't open up the door to saying that a user could actually decide they don't want to check, whether employees are working sick or not. Right? We were like, you have to check whether an employee is sick or not. Now today, after the pandemic, we've gone through this. Everyone knows we have to do that for respiratory diseases too, right? To keep our restaurants open. In our business, but that's another lesson learned that we just were not going to go out there and build. You can choose whether to watch your children in the cul-de-sac or not. It's just like we're just saying no. You're going to do this, this, and this to make sure your child doesn't get hit by a car in the cul-de-sac. And if you want to do all these other things, we can certainly code and build those. But that's kind of how we looked at it. So again, that had nothing to do. In any failures, I think our failure is that, going to market, that's harder to sell, right? You do it our way or no way kind of thing in an app. But we kind of saw that as our expertise, and we've done it. We put it in place in many different situations where we prevent outbreaks, and that's how we want to do it. So really that's, when you guys are working with us, you did exactly what we asked you to do. We made it.
Awesome. Yeah, it's all really good tidbits, I think, for folks that are maybe thinking about going down this road. So one final question, Hal, obviously, as we all know, with the rise of COVID, I think that public health has just come into the forefront of everyone's mind, for anyone and everyone in a way that it never has been before, which I hope maybe that is one of the silver linings of all of this is kind of an increased focus on public health and really what the implications are. So for you, from your standpoint, what do you see as the biggest kind of trends and shifts that are coming in the public health space? And what role do you think technology plays in that? I know it's a big question, but just your off-the-cuff thoughts, I'd be curious.
Yeah, so, no one likes to use the word the new normal because we're all hopeful that vaccines and science and we'll all get rid of this thing. I think it's always been normal for us to have infectious diseases and pandemics and epidemics. We have foodborne diseases in the United States are epidemic, right? So they're specific to our country or other countries, but they still cause a lot of people to die from eating food, or diseases that we all worry about to fight. I think like you said, the silver lining on anything related to, and you hate to call that, you even use those words sometimes too, I know, in public health, because so many people are dying today, every day. There's thousands of people dying every day from this disease. And again, it's because of this, we weren't aware that there would be a virus that actually could be spread at this high rate. 80% of the people are spreading the virus with no symptoms. When you get the flu, you usually have symptoms, and you know to stay home, and people know to stay away from you. Like, oh, you got the flu, but this thing is just a silent killer. You don't know, and so some people kind of think about the trends that we're seeing that people aren't complying to mask wearing and all these other things. I don't give them an excuse for not believing those things are effective. I just say it's the environment and the pandemic we're in, that when you can't see it and it's transmitted so easily between people, and again, it's not a high percentage of people that actually get sick and die, but it's plenty, right? It's thousands a day, so it's plenty. It's too much. But at the same time, we can't just start blaming people, because they've done this or whatever. I think public health says we all try to figure out what we know and use it to stop the deaths. And that's what we're doing. So wearing the mask, staying social distance, don't go in enclosed spaces for long times without the mask. If you have to, making sure you're doing, staying in your bubble, and vaccines coming, make sure you get the vaccine. And I think in the future, air disinfection, things that we got to start doing and thinking about that we didn't think about before. Should we tolerate that people can get disease transmitted through the air, and hope they live if they get the flu? Well, we had thousands of deaths of flu every year before we had a vaccine for flu, right? Should we is that gonna do we need to change the way we're thinking about public health now, and start putting in better interventions that can save lives, and not just rely on people complying to things and relying on vaccines, because we're going to still have this disease even with the vaccine, because we don't even know if it can be spread after you get the vaccine, if I can still get infected and still give it to others even when I've been vaccinated. So to me, I think the major trends are, I think good positive news is that we have kind of gone through this journey across the world to be aware that we have to think more about the public health, in addition to just how much we think about our personal health. And so I like to tell people, do both. Definitely personal health, your family's health, protect your family, children, your grandmother, your mom and dad. But you got to now all start thinking about public health. Public health is not is not something that the CDC does or the WHO does. Like I said in the very beginning when I started talking about this, they don't manufacture anything. They manufacture knowledge, which is good. We need them to do that. But public health really actually happens when you and I decide that we're going to wear a face covering and not do certain risky behaviors that might lead to someone else getting sick. It's the same thing as making sure I know what the issues are in food when I'm preparing food in a restaurant, because I know that someone could die from, say, a sesame seed allergen in the food if they don't know there's sesame seed in my food. That's actually thinking and changing your way your public health says, I need to make sure that can't happen. I don't think of it. I don't think about it after it happens. Someone dies. Oh my goodness, I didn't know that. If you're running a food business, there are hazards. You need to understand what they are. Make sure you put the controls in. That's public health to me, and that's the business that we are in, and you guys too, by association and partnership, are in. That we know the knowledge. We get more knowledge from all the researchers and academia and government, but we need to actually apply it. And again, I think because there's so much new stuff constantly coming at us with new diseases, technology is the really only way to keep up with all that knowledge and transfer it into the public health to be able to do that. So, look at technology now. It's going to be used I downloaded this app from a company that's for this home test that they're going to be using to actually take the technology, do the test on the mobile app, collect the results, record them, and then when I go to travel, I'll do my QR code like we do our boarding pass. They'll look for my QR code to show that I've been tested or vaccinated, right? That's technology could actually help us open up our economy again by getting that information quick. And so it is key to public health. But again, I'll end with, and again, thank you so much for letting me have the opportunity to talk, because I'll talk all day. I can teach a lecture for 3 hours if you want to. But it really, I think it's important to say, and we all do, that we got to be thinking like public health, and don't leave it to the public health scientists like me. It's your public health, it's just an additional part, an extension of your personal health. But now we're all going to have to do this so we can make a safe place to live and grow our economy. So, and thank you guys for the part you play in that.
Thank you, Hal. Well, this has been really great. We knew for our first episode that you would be the best and first choice. So we're so glad we could make it happen. Before we sign off, where can listeners go to connect with you or learn more about public health innovations?
They can just Google the word public health innovations, our website. If you just Google public health innovations, you'll find us. We pop up very quickly. We're here to help whoever as it relates to, we do focus and work on food a lot, but we also work on indoor and other safety issues like Legionnaires' disease, all kind of other things in public health innovation. I mean, we had companies come to us that want us to look at their new products, and their new ideas to see if it might have a role in public health. So just give us a call and let us know how we can help you.
Awesome. Well, thank you again, Hal. It's been great having you on the Digital Footprint, and we'll talk to you soon.
Great.
Thank you for listening to the Digital Footprint. This show is brought to you by Tyrannosaurus Tech, an award-winning technology partner dedicated to designing and developing high-impact software products. If you like what you heard in this episode, make sure to subscribe to the podcast on Apple, Spotify, or wherever you get your podcasts. For show notes and access to all episodes, please visit tyrannosaurustech.com/blog. Digital Footprint.